Safe lifting tips. How do you lift objects? Do you keep your back healthy? One of the biggest causes of back injury is lifting objects incorrectly. So the big question is, how to lift a light or heavy object safely? What is the recommended way to lift heavy weights? Of course, one of the common mistakes is rounding the back, which creates a serious risk of damaging the lumbar vertebrae. The deadlift is suitable for heavy weights. Keep your back straight. Hold the load as close to your body as possible. This principle is very important in lifting weights high. Variation: deadlift with arm support. Another option for lifting heavy objects is the squat. Here too, we must make sure to keep the weight near the body and keep the back straight. The erector spinae muscles stabilize the spine. Another option is lunge with arm support. Resting the arm on the thigh directs the forces to the ground. Bend the knees and keep the back straight. This variation is like the squat, but with legs closer together. On the left, we see a movement that is not recommended because it creates ongoing damage to the lower back. On the right, we can see careful maintenance of a straight back. What about light objects and forward bending? Bending forward is not a contraindication in our daily life. It is a very important movement to be kept and maintained. In many occasions in life, we need and should use segmental rounded bending in healthy back cases, such as in tying shoes, picking a light object off the ground, etc. In many daily activities that are not involved with high or vertical pressure, rounding the spine comes naturally. What about bending forward with a pathological spine condition? In cases of various back pathologies, this pattern should be avoided due to intervertebral disc problems. In a pathological spinal condition, it is recommended to maintain a straight back even when lifting light objects. Note, you should consult with a doctor in any pathological condition. For lifting medium to heavy weight, keep your back straight. For a lightweight object, we need and should use segmental rounded bending. In a pathological spinal condition, it is recommended to maintain a straight back. There is no one way to bend. We should teach our students or patients various strategies for bending, allowing them to choose the right way depending on the specific functional demands.